Physiology students. Welcome back to another lecture, and this one's going to be on peripheral nervous system physiology, and it's chapter 4, part 3. All right, so let's share the screen and we'll get started. Okay, so peripheral nervous system. So the peripheral nervous system is everything that's neural outside of the spinal cord. And what we're going to emphasize heavily in this chapter is how sensory information from your peripheral nervous system ascends the spinal cord to be interpreted by the brain. And then motor commands coming down from higher brain regions are going to come down the spinal cord and go to the peripheral nervous system. And there's going to be voluntary motor control for skeletal muscles, and then there's involuntary or autonomic motor control for things that you have no control over, specifically heart muscle, smooth muscle, and glands. In nursing pharmacology, they're going to particularly want you to know that autonomic control of the body and how it can differ based on whether it's your fight, flight, sympathetic response or it's your rest and digest parasympathetic response. So let's begin. So sensory information is going to basically come in from your peripheral nervous system, all those sensory receptors, and it is going to rise up through the spinal cord to the brain where it gets interpreted. So there's 3 blocks of ascending information. One is going to be, let's see, your somatic sensory system. So that's going to be taking sensory information from skin, joints, fascia, and muscle, okay? The next ascending information block is the visceral sensory system. That's all sensory information from your organs, like how much your stomach stretches or like your lungs and things like that. All right. Even your bladder, when it stretches, that sensory information goes up to your brain and you realize, oh, I have to pee. Okay. Now, the last block of ascending information is special senses such as, temperature, pressure, touch, hearing, taste, all those special senses. So now that information is going to go up the spinal cord to the part of the brain where it's interpreted. Most of this is going to be interpreted in the parietal lobe's sensory cortex. Now, moving over to the descending information that comes from higher brain regions, that's going to be motor commands, and that's going to be under 2 categories. The voluntary motor responses, that is going to be your skeletal muscles because you have control of those. And then involuntary motor responses, that's going to be for things you have no control over, like heart muscle and smooth muscle and glands. Now, where do we have smooth muscle in our bodies? We have smooth muscle lining our arteries so that they can vasoconstrict or vasodilate. We have smooth muscle in our bronchioles that allows them to bronchoconstrict or bronchodilate. We have smooth muscle. The uterus is made of smooth muscle. You don't have any control over those things. Okay, so let's start with voluntary motor responses. So that is going to be for your skeletal muscles. Now, this is a return to chapter 4, part 1. All voluntary movement of your skeletal muscles works by one neurotransmitter for contraction. Okay, now please ignore that red laser. That is from a previous recording. So try and ignore it as best you can. But voluntary skeletal muscles work by acetylcholine, okay, abbreviated ACH. Now, the receptor for acetylcholine has the name acetylcholine in it. Well, it has a choline in it. The receptor is called a cholinergic receptor. Now, there's 2 types of cholinergic receptors. There is one for voluntary movement, and there is one for involuntary movement. The one for voluntary movement is going to be called a nicotinic cholinergic receptor. Now, here's how you can remember the difference between that receptor and the muscarinic cholinergic receptor that's for involuntary body functions. Nicotinic. Think of a cigarette if this pen were. If it were a cigarette, you'd have to use voluntary muscle action to put it to your mouth to smoke it and get the nicotine in the cigarette. So when you think nicotinic, think cigarette that has nicotine. You have to voluntarily pick it up to smoke it. So that's the receptor that all our skeletal muscles have for acetylcholine. And do notice choline is in the name of the receptor. Okay. Now, for involuntary responses, that's going to be heart muscle, smooth muscle, and glands. Okay. This is autonomic body functions. This is like functions that are so important that you have no voluntary control over it. Now, what happens is this subdivides into rest and digest functions under parasympathetic control and fight flight functions under sympathetic control. So we're going to go to the next page where we'll look at the division of sympathetic and parasympathetic regulation of the body, because that is how these autonomic functions are regulated. Okay, so on the left here, I have in cool blue parasympathetic responses. This is rest and digest. This is what happens when your body is calm. Okay, so under rest and digest, stop. Think about what would make sense for body functions to happen under rest and digest. If it's rest and digest, do you think your heart rate's going to be sky high, or do you think your heart rate's going to be low? If you guess low heart rate, that is absolutely true. Okay, so heart rate will be low, and that will make your blood pressure also low. Okay, so that makes sense, right? Now, under rest and digest, do you think your bronchioles are going to be open maximally to get all possible air in? Or do you think they're going to bronchoconstrict a little bit because you don't need maximum air because you're not running for your life? They will bronchoconstrict a little bit. They don't close down, but they bronchoconstrict. Now, all things GI, if it's rest and digest, all things GI increase because it's a good time to digest. So GI tract smooth muscle peristalsis goes up. GI secretions like mucus and gland, like digestive enzymes and all those secretions increase. It's a good time to digest. Furthermore, arteries going to your GI tract open up wide because when you're digesting all that food, you've got to have that nutrients being absorbed into your bloodstream, and you need that good blood flow to the gut because it's being very metabolically active. So it needs a good blood flow. So you have vasodilation of arteries going to the GI tract. Now, if it's rest and digest, it's a good time to go potty. So urination and defecation will increase. Okay, all parasympathetic responses, these that we've covered and others that I haven't, work by the same neurotransmitter, acetylcholine. The receptor for acetylcholine ends in the word cholinergic, but the word in front of cholinergic reflects that these are autonomic functions and that you must do them. You must, because you have no choice. So they are muscarinic cholinergic receptors. See what I did there? So for voluntary actions, skeletal muscles, the cholinergic receptor is nicotinic because of the nicotine in the cigarette, right? But for autonomic functions under acetylcholine, you must do them. So it's muscarinic. All right. So hopefully that'll help you remember it. Now, fight flight, it's sympathetic. Your body, you're in danger. Okay. Last time I went for a bike ride in my neighborhood, a big dog came out to the road and chased me, and I went into full fight flight mode. So what's going to happen under fight flight? What will be happening to your heart when you feel like your life is in danger? Your heart rate skyrockets, okay? And your blood pressure skyrockets. Your body's speeding the rate at which oxygen and glucose get to your body. Now, the smooth muscle in your bronchioles are going to open up wide to give you maximum airflow, all right? You're going to be panting. So you'll have bronchodilation. Your body needs all available oxygen that it can get to escape the situation, because you need oxygen in your brain, you need oxygen for your heart to work, and you're going to need oxygen to your skeletal muscles so that they can get you out of the danger. If it's fight flight, it's not a good time to digest. Your body is going to shut all that down. It's going to decrease peristalsis, shut down GI secretions. Digestion is not going to save you. Your body is not going to waste valuable resources on a system that's not going to save your life. Artery, smooth muscle going to the GI tract shuts down, it vasoconstricts. The body doesn't want to waste blood on an organ system that's not going to save you. Your body will be diverting blood to things that will save you, your brain, your heart, and your skeletal muscles, so you can get away. So while we're talking about skeletal muscles, blood supply to your skeletal muscle increases. You have vasodilation of those arteries, because your skeletal muscle needs the oxygen and glucose so they can function and you can run away, or if you have to, fight. Now, if it's fight flight, it is not a good time to stop and go potty. So urination, defecation are inhibited. Now, fight flight works by epinephrine. The neurotransmitter is epinephrine. All right. So epinephrine is also known as adrenaline, and the receptor for epinephrine has the word adrenaline in it. They're called adrenergic receptors, adren for adrenaline. But I teach you three different receptor, the first parts. There's a beta 1, a beta 2, and an alpha adrenergic receptor. Okay, so we'll start with beta 1 adrenergic. It says here that is what will increase your heart rate right here. Okay, think about it. How many hearts do you have? One. And what does this receptor, when it binds to epinephrine, do? It makes the heart go beep, 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 beep. So beep, 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 beta 1. Okay, now how many lungs do you have? 2. So the adrenergic receptor to cause that bronchodilation in fight flight, that's a beta 2 adrenergic receptor. Beta 2 adrenergic receptors are also found on arteries going to your skeletal muscle, and that causes them to vasodilate, as is shown here. So here's how you remember beta 2 is for the bronchioles and artery blood supply to skeletal muscles. You have 2 lungs, so beta 2. And blood flow to your skeletal muscles is best to get away. Best to, beta 2, all right? So hopefully you remember that. Now lastly, alpha adrenergic. When I think of alpha adrenergic, I think of the A or the symbol for alpha, and I think of apple. Begins with an A too. What do you do with an apple? You eat it, right? Chew it up, digest it, right? So when you think alpha, think apple. It is the receptor epinephrine binds to shut down all GI activity, shut down peristalsis, shut down secretions, even vasoconstrict arteries to the gut, because that system is not going to save you in fight flight. All right. So the last thing I have to do after I chew my piece of apple here is to talk about the nerves. So the vagus nerve controls that rest and digest function of your heart and your GI tract. So, and then the sacral nerves control the urination defecation reflex when you're in rest and digest. So here's how I remember the difference between the vagus nerve and the sacral nerve. The vagus nerve, think Vegas, on vacation, in Vegas. Or I don't like Vegas, but think about being on vacation. When you're on vacation, are you stressed? Hopefully not. Hopefully your heart rate is low, your blood pressure is low, and it's a good time to digest when you're on vacation. You can have really cool dinners if you're on vacation, okay? Sacral nerves. The sacrum bone is the backbony part of your pelvis. And so when I think of sacral nerves, I think of soothing sacral nerves, soothing sacral. That is what increases urination and defecation. Now, if I go over to the fight, flight, danger, danger in red, we have thoracic nerves that control what's happening with your heart and your bronchioles and your GI tract, okay? And then the lumbar nerves, remember lumbar means lower back, so it's lower region. That is what shuts down the urination, defecation, and fight, flight. So here's how I remember thoracic and lumbar as being part of the fight, flight. When I think of thoracic, of course, your heart is in your thoracic cage. And I think thoracic tenses you up. All right, T, thoracic tenses you up. You're tensed up in fight, flight. And so those nerves control all these functions in this red box. The lumbar nerves for urination, defecation, inhibition, I think, let's get the hell out of here, lumbar nerves, okay? So soothing sacral, stimulate urination, defecation. Lumbar, let's get the hell out of here, lumbar nerves, shut that stuff down. On vacation, okay, vagus nerve controls all the rest and digest functions of your heart and GI tract. But the thoracic nerves tense you up and cause all the fight flight responses you see with the heart and the GI tract and the lungs. Okay, so hopefully that helps you out. So let's continue on. It's going to be the same information presented in now, instead of just words and text on the screen, a figure. Okay, so let's look at it. Now, if you are looking at this PowerPoint from my online syllabus, if you click on there when you're on the PowerPoint PDF, you'll be able to go to a blank flowchart, which is the one that we just did. Okay, and then if you go online and you click it, it'll come up here in a second. Oh, my key, that's the blank. I'll have to fix this. It didn't show. All right, but there's a blank and there's a key, and I'll make sure that link works for you. Okay, don't freak out. This is the same information that we just went over under rest and digest and fight and flight. It's just a figure. So what we've got at the top here is the on vacation vagus nerve controlling what happens in the thoracic cavity and the abdominal cavity when it's rest and digest. So it's not even shown on this screen. Use your imagination. What's happening with the heart under rest and digest? It's decreasing, which makes your blood pressure go down. What's happening with your GI tract activity when it's rest and digest? All of it's going to go up because it's a good time to digest. They call it rest and digest. It's not a chance that you won't be digesting. Now down here, soothing sacral nerves is going to control the increased urination and defecation. All right. Now the neurotransmitter all this works by is acetycholine, and the receptor is going to be called cholinergic. And since it's for functions that you have no control over, you must do them. It'd be muscarinic cholinergic. All right. Now, at the opposite scenario, fight, flight, danger, red, red, red. Okay. We have the thoracic spinal nerves. Now, that's definitely going to control things happening in the thoracic cage, like your heart, but it also is controlling what's happening with your lungs and your GI tract. If it's fight, flight, it's not a good time to digest, but your heart rate will go up, right? So heart rate goes up, blood pressure goes up. What would make sense to happen to your bronchioles, your airway? Are they going to bronchoconstrict, limiting airflow, or are they going to open up wide? They're going to open up wide. They're going to bronchodilate because you need all the available oxygen you can get. Now, if it's fight, flight, is it a good time to digest? No, that's not going to save you. In fact, that would, if you stopped to eat, running away from that dog chasing me on my bike, probably would have gotten me. So no, not a good time to digest. So your body shuts all that down. GI peristalsis, GI secretions, blood flow to the GI tract. Shut all that down, okay? The lumbar, all right, so remember that thoracic nerves tense you up, all right? The lumbar inhibits the urination and defecation. So remember, lumbar, let's get the hell out of here. Let's get the hell out of here. Don't stop and go potty. It's not a good time, all right? So I'm just repeating the same information I've covered before, but now it's in a figure format. And hold on, the receptor and neurotransmitter, the E stands for epinephrine, which is known as adrenaline. It's going to have an adrenergic receptor, okay? And there's going to be a beta 1, beta 2, or beta 3. So how many hearts do you have? 1. The beta 1 adrenergic receptor increases your heart rate. How many lungs do you have? 2. The beta 2 adrenergic receptor, when it's bound with epinephrine, causes the bronchodilation, opening up the airways. And the beta 2 receptor is also best to get away. That vasodilates arteries going to your skeletal muscles, because your skeletal muscles are what's best to get you away. That's also a beta 2 receptor. Now, if you remember alpha for inhibiting GI tract activities, remember the apple? Think alpha, think apple. Apple, you digest. So alpha adrenergic receptor is the receptor that it will inhibit all the gastrointestinal activity in fight flight. Not a good time to digest. Okay, so let's move on to another figure that even looks more scary. But all they've done is they've drawn a lot of lines to different organs. Okay, so a blue line, everything is cool. It's rest and digest, cool blue, right? Red line, danger, danger. That's fight flight. So I'm just going to focus on the systems that I covered. If it's rest and digest, it's parasympathetic control. If we look at the vagus nerve, that is going to control the drop in the heart rate. So if you follow the cool blue going to the heart rate will go down. Look at the blue line going to your bronchioles. During rest and digest, your bronchioles constrict down a little bit because you don't need maximum airflow. You're not in danger. Now, the other things, if you follow the blue lines, look at all the blue lines going to all the digestive structures, the stomach, the pancreas, the gallbladder, the small and large intestine, okay? That under rest and digest is going to have increased activity. So between the lungs, the heart, and the GI tract, that's all controlled by the vagus nerve. On vacation, everything's cool. The neurotransmitter is acetylcholine, and the receptor is muscarinic cholinergic. Now, the soothing sacral nerves go to the colon and the bladder, and since it's rest and digest, that is a good time to go potty, okay? They work by the same receptor and neurotransmitter. The flip side is danger, danger, fight, flight, and red. And so they have a red line. So the thoracic nerves are going to stimulate the increased heart rate and the bronchodilation that you see. Okay. So if you follow those red lines to the heart, now your heart rate skyrockets. At your bronchioles, now they will bronchodilate so you get maximal airflow. If you follow the red lines to all things GI, it's going to shut that down. Okay, that's not going to save you. All right, so thoracic nerves tense you up. That's fight, flight. Lumbar, let's get the hell out of here. Lumbar nerves, let's get the hell out of here. Don't stop to go potty. Are going to go to the colon and the bladder and inhibit urination and defecation because that's not going to save you. Now, you know I'm going to ask it. It's fight, flight. It is ruled by epinephrine, known as adrenaline, okay? It's going to be an adrenergic receptor. There's beta 1, beta 2, and beta 3. Which one's on the heart to increase heart rate? How many hearts do you have? 1, beta 1. Now, what's the receptor for epinephrine on your bronchioles? Well, you got 2 lungs, beta 2. Not shown here is arteries going to skeletal muscles. That's also beta 2 adrenergic because it's best to run away, beta 2. Now, I think that's it. Oh, yeah. Shutting down all things GI. Its adrenergic receptor is, right? Apple, alpha adrenergic. Okay. So hopefully that helps you remember this. And we're going to repeat it yet on another slide. So here we have parasympathetic control of the body and then sympathetic control of the body. Down here, look, it's secreting acetylcholine. And whatever the parasympathetic rest and digest effects are, they're all going to work by the same receptor. Muscarinic, because it's for functions you must do. Cholinergic, all right? If it's sympathetic, it's going to be epinephrine. It's going to be binding to an adrenergic receptor. So here, let's skip ahead. Alpha, apple, adrenergic receptors shut down GI secretions and peristalsis. All right. It also shuts down blood supply to the gut. The body's not going to waste energy on that. Now, the heart, epinephrine's going to bind to a beta 1 adrenergic receptor because there's one heart. And then for your bronchioles, they're going to work by a beta 2 adrenergic receptor. And that receptor is also to vasodilate arteries to your skeletal muscle because they're going to be best to get away or best to fight on fight, flight. All right. Now, this is a chart, a table of effects of acetylcholine. It's the same information. So acetylcholine is what controls your voluntary skeletal muscle contraction. It's acetylcholine, all right? The receptor for skeletal muscles for choline, acetylcholine, is nicotinic cholinergic. Remember the cigarette with nicotine, all right? Nicotinic cholinergic. And when those receptors are bound, you get muscle contraction. Now, for parasympathetic control of the body, it's always going to be acetylcholine. It's going to be muscarinic cholinergic. And you can think about what smooth muscles will do. Bronchioles will bronchoconstrict. Glands, GI glands will increase their activity. GI tract smooth muscle will increase peristalsis. It's a good time to digest. On your heart, if it's rest and digest, your heart rate will come down because you're calm. All right? Okay. Now let's look at sympathetic effects and parasympathetic side by side. Same information I had in my original figure, my flow diagram. So sympathetic, red, red, danger, danger. They all work by epinephrine binding to an an adrenaline receptor, adrenergic receptor. And there's three types of receptors. All right. Heart rate goes up because of the beta 1 adrenergic receptor. Your lungs, your bronchioles dilate because of a beta 2 adrenergic receptor. Um, GI tract activity decreases in fight flight. That's alpha adrenergic. Okay. Parasympathetic, heart rate goes down. Your GI activity increases. Your bronchioles constrict down a little bit. Those effects are all from acetylcholine binding to muscarinic cholinergic receptors. Okay, so notice how I've repeated the material and repeated the material, and I've shown it to you in different formats because that's the best way to learn it, is to look at it in different formats and to be thinking about what makes sense for a body function under rest and digest, cool blue, versus fight, flight, danger, danger, red. Okay, and then work backwards and remember the neurotransmitter they work by and what receptor they work by. Okay, so here is adrenergic effects, fight, flight, danger, danger, red, okay, with the receptor for epinephrine or adrenaline. So the heart, it's fight, flight, your heart rate's going to skyrocket because epinephrine binds to the beta 1 adrenergic receptor. All GI blood flow and activity, so here GI blood vessels and stomach and intestine, they all work by alpha adrenergic, and it's going to shut down all those activity. Skeletal muscle arteries, beta 2 adrenergic receptor. Remember, best to get away or best to fight. Now, your bronchioles are also beta 2 adrenergic receptor, and those bronchioles will dilate open so you can get maximum air. So, why am I teaching you all this, and why do you need to know it for nursing pharmacology? Well, a lot of common drugs work on these receptor systems. So, if you think about it, some of the most common health problems that we have in the United States is hypertension, high blood pressure, cardiovascular disease, and diabetes. But high blood pressure is a pretty common one. Okay, you probably know of someone who, for high blood pressure, is on a beta blocker, right? Well, let's talk about beta blockers. Beta blockers are drugs that are meant to block a beta receptor either on the heart or on the lungs, okay, the bronchioles. But if you want to treat high blood pressure, you really kind of want to block the beta 1 adrenergic receptor on the heart, because what will happen is epinephrine won't be able to increase your heart rate. Your heart rate stays lower, and then your blood pressure stays lower. Whatever the heart rate does, blood pressure follows. So the first beta blocker that was developed was called propranolol, right here. Propranolol blocks both the beta 1 receptor on the heart to decrease your heart rate, but it also happens to block the beta 2 adrenergic receptor on your bronchioles, leading to them to bronchoconstrict a little bit. Okay, so this drug, propranolol, is good for people to treat people who have high blood pressure, but you don't want to give it to someone who has any respiratory problems whatsoever, like asthma or COPD or COVID, okay? Because it will bring their heart rate down, but it'll also cause their bronchioles to constrict. And if you're an asthmatic, that could drive you into respiratory distress, okay? They have since developed a beta 1 specific blocker that will not touch the beta 2 receptors on the bronchioles. That drug's name is atenolol. So atenolol just blocks the beta 1 receptor on the heart. Heart rate comes down, and so does blood pressure, and it doesn't affect the bronchioles. Now, here's how I remember the difference between them two. The word attenuated means to be made specific to something. And when I think of the word attenuated, well, vaccines are attenuated. The flu vaccine that we get every year has been made specific to one or a couple strains of flu virus. So when I think of attenuated, I think it's been made specific to one thing. So when I think of atenolol, I think of the word attenuated. Atenolol has been made specific to the beta 1 receptor. Okay, so hopefully that helps you. Okay, so this would be a good drug for someone who has high blood pressure and asthma or COPD or COVID or any other respiratory problem, because it'll bring their heart rate and blood pressure down without affecting the respirations. Okay, So let's move on to some agonists, things that stimulate a receptor. Let's say you have a patient whose heart is not very effective. They've got maybe some heart disease or something, and their heart is just not pumping out the blood like it should. You can give them a beta 1 agonist called dobutamine. Dobutamine targets and stimulates the beta 1 receptor on the heart, making heart rate go up. Okay, it will make blood pressure go up, but it increases your cardiac blood output. So when I think of dobutamine, I think of it makes the heart beat faster. Okay, dobutamine makes the heart beat faster. I know it's silly, but it works for me. All right. Now, let's say you have a person who doesn't have good cardiac output and you want to increase it, and maybe they're also having some respiratory problems and you want to open up their airways wide. Isoproterenol will stimulate the beta 1 receptor on the heart, making heart rate go up and cardiac output go up, and it will also cause bronchodilation to help them breathe better. There's a drug for everything. Now, if you have asthma or you have problems with your bronchioles having bronchospasms, because that's what happens with an asthmatic, is something stimulates a bronchospasm and they have a hard time breathing. The drug albuterol and terbutaline and some others are a beta 2 agonist. It's going to stimulate the beta 2 adrenergic receptor on the bronchioles, and that makes them bronchodilate. So it opens up their airway. But these are rescue inhalers and should only be used for an emergency when your airways are closing up on you. The thing to know about these emergency inhaler drugs, these beta 2 agonists, is if they're used regularly, not for emergency, but on a daily, your body will build up a tolerance to them and they won't stop, they'll stop responding. So the last thing an asthmatic wants to do is to use these regularly and have their body stop responding to it. They're emergency inhalers for a reason. Okay, so people who have asthma should also be on anti-inflammatories to stop the inflammation process in its track so you don't have as many episodes of asthma. All right, so we've got a little bit more after this, but this is more than enough for the first lecture in this chapter. So I'm going to go ahead and stop the share.